Hey everybody! Today we're going to talk about a topic and a diagnosis that you have asked for a very long time, so thank you for your patience. Today we're going to talk about schizotypal personality disorder. Now, as always, when I talk about a DSM diagnosis, I read it from said DSM. And obviously the DSM, as always, isn't the end-all be-all, but it gives us a little more structure to a diagnosis so we can tell how it's diagnosed and how it may be experienced by those who struggle with it. Now, in order to diagnose schizotypal personality disorder, the DSM states that they must have a pervasive pattern of social and interpersonal deficits, meaning that they really don't interact with people that well or make friends that well, and their relationships struggle as a result. And it's marked by acute discomfort with and reduced capacity for close relationships, just like I said, as well as by cognitive or perceptual distortions, meaning that they may think or see things that maybe aren't there or that other people don't see or hear or think, and eccentricities of behavior, just meaning odd behavior that quote unquote isn't normal to others, beginning by early adulthood and present in a variety of contexts. So meaning it doesn't only happen at work or only at school, it happens, all the time. And as indicated by 5 or more of the following. And I know that I tried to explain it a little bit because I know that can be really hard to follow, but hopefully as I read through the other criteria, you can kind of get a better understanding of what schizotypal personality disorder can look and feel like. Now the first, remember they have to have 5 or more of the following. The first one's a little confusing, but it's called ideas of reference. And what that really means is that we would believe that everything that's happening around us has some extreme personal significance, like, oh, but this is leading me to my destiny. This is part of my fate. And they will talk about situations in their life that you would not think are connected to them in any way, but they'll talk about it as if it's part of their destiny. And the second is odd beliefs or magical thinking that influences behavior and is inconsistent with subcultural norms. That means that they, will think they have a sixth sense, or they believe in clairvoyance or telepathy. In children and adolescents, they'll have really bizarre fantasies or preoccupations with them. And you can see how it says that are inconsistent with subcultural norms, meaning it's not part of your religious belief, it's not part of something culturally that your family believes. This is something that's just you believe in it, and you have a lot of magical thinking that really we don't have any reference for. The third is that we have unusual perceptual experiences, including bodily illusions, meaning that the things that we perceive are happening are just really odd. And I know that this whole criteria is just hard to understand, but the way that I remembered this when I was studying for my licensing exam is that people with schizotypal personality disorder, everything that they take in, almost like all of the senses, are just a little odd to the quote-unquote normal person. And so they can be viewed as a very odd person, or something's off, but I'm not sure what. And they don't honestly feel that way. They feel that everything that they're experiencing, everything they're seeing is real and valid, and they can feel it so intensely. And so hopefully that kind of puts that in perspective. And the fourth is odd thinking and speech, meaning that it's like vague, circumstantial, metaphorical. They can speak in metaphors a lot, and it can be really difficult for people to follow or understand where they're even coming from. And the fifth is suspiciousness or paranoid ideation, meaning they just don't want to trust anybody or anything. They're very suspicious of everyone. And the sixth is inappropriate or constricted affect. And this is why this can often be misdiagnosed or confused with antisocial personality disorder, which I have a video about. You can click the link in the description to watch more and learn more about that. And the seventh is behavior or appearance that is odd, eccentric, or peculiar. And remember earlier I was saying how people can perceive them as just being a little off. And if anybody asked exactly what it is, we might not really know, but we're like, something they're doing just isn't quite normal. And number 8, they have a lack of close friends or confidants other than first-degree relatives. Remember when I first started talking about this, I said how they really struggle interpersonally, and can be because they're really suspicious, right? If we struggle with suspiciousness, it's hard for us to trust people and let people in. And then also if we kind of act a little odder, we may see things that aren't there or believe that everything around us is happening as part of our destiny, and we talk in metaphors a lot, it can be difficult for others to connect with us and for us to connect with them. And then the ninth and final one is excessive social anxiety that does not diminish with familiarity. and tends to be associated with paranoid fears rather than negative judgments about self. I think that's really important too, that this disorder is kind of born out of anxiety, and you can really struggle to connect with others, to put ourselves in situations where we're gonna be, around people we don't know. Even if we get to know people slowly, that doesn't make us feel better. I think that is why overall it's really hard for people who struggle with this, because having close relationships is something they just feel incapable of and they can really struggle with. And even when they try, they feel horribly uncomfortable. And another note under the diagnostic criteria, which I feel is really important to talk about, is that it does not occur exclusively during the course of schizophrenia, a bipolar disorder, or depressive disorder with psychotic features, or other psychotic disorder, or autism spectrum disorder. And what they're really saying is the reason that that is brought up as such a portion of this diagnostic criteria is that schizotypal personality disorder needs to be given as a diagnosis with a lot of caution, because there are a lot of different disorders that can look similar to it. A lot of symptoms have overlap. Like I said, like antisocial personality disorder, they lack empathy for others, right? But another thing is they have blunted affect or constricted affect, which also occurs in schizotypal. Then, because we struggle with social anxiety, you need to make sure it's not part of that. Also, because we're extremely suspicious and have a lot of paranoid thoughts, we want to make sure that it's not due to schizophrenia. So when given this diagnosis, or if you think that you may be struggling with it, make sure that you spend a lot of time with your therapist or psychiatrist or psychologist. Make sure they know you well enough to be able to see where this is coming from and make sure that this is the proper diagnosis for you. Another important thing to note is that those who struggle with schizotypal personality disorder may prefer to be alone for obvious reasons, namely the social anxiety component or the suspiciousness. It would make it really hard to connect with others, and so many say they prefer being alone. Another important thing to mention is that we are more likely to have schizotypal personality disorder if a first-degree relative has had it. And so taking a proper history as a clinician and making sure as a client we tell them about that is really pivotal to making sure that we get the proper diagnosis. In a nutshell, schizotypal personality disorder is characterized, and I'm reading my notes, by a need for social isolation, anxiety in social situations, odd behavior and thinking, and often unconventional beliefs. I think it's really important to just kind of sum it up, because I know that the diagnosis as a whole can feel kind of confusing and overwhelming. So I hope that helps kind of explain it more succinctly. That's how we diagnose schizotypal personality disorder. But more importantly, how do we treat it? Are there things that we can do to get better? And of course, there are. Hooray! And the first one is honestly therapy. Psychotherapy, like what I practice. Because of the social anxiety component, there are a ton of behavioral techniques that we can use. Also, since many people with schizotypal personality disorder will say that they feel odd and like they don't fit in with anyone, there are a lot of social skills and workshops that they can get into to help them with that, so that they get a better understanding of how to interact with others so they can feel like they fit in. And as a side note, if you're a clinician watching this, I think it's important to note that we need to be very warm, understanding, and supportive of our clients who struggle with this. We can't go in and attack their delusions or their magical thinking and beliefs, because that can make them feel even worse and actually make them want to go inside and push us out so that no further therapeutic work can be done. As a side note, they do not recommend support groups. Because they have such high social anxiety, putting them in a situation like that can be overwhelming and can actually be detrimental to their recovery. But another component of treatment is medication. And I know not everyone wants to be on medication, and it's always your choice. You can always talk to your doctor, make sure you understand the side effects, you understand, what the possibilities of that medication can do for you, etc. Make sure you're well informed. However, mood stabilizers, anti-psychotics, SSRIs have all been shown to be extremely beneficial for those who are struggling with schizotypal personality disorder. I hope you found that helpful. I know that this diagnosis can feel really cumbersome and confusing at times, and so I hope that I did a good job explaining it. And if you are out there and you've been diagnosed with this, can you leave in the comments what your experience is? Because even though I can read through the diagnostic criteria, I can't share personal experience. And that's what makes our community so wonderful. And if you're new here, click here to subscribe, because I put out videos twice a week and you don't want to miss them. And I will see you guys next time. Bye!